STDs, sexually transmitted diseases, which include gonorrhea, syphilis, chlamydia. Those are some of the main ones that we discuss. And they're caused by different agents. The gonorrhea and syphilis and chlamydia are caused by different bacteria. And they are contracted from sexual intercourse that's unprotected, no barrier in terms of a condom. And they can cause sores, in women, they can cause pelvic inflammatory disease and serious infection that can make you sterile. I've actually seen someone die from pelvic inflammatory disease that was not treated. It can, what we call, disseminate to other parts of the body. So diarrhea can affect your gonorrhea, can affect your joints and other parts of your body as well. And syphilis can do that. If it's not treated over the years, you can get, it can go to your bones, it can go to your blood vessels and cause aneurysms that rupture, and it can go to your brain and cause neurosyphilis and a form of altered mental status, dementia. Well, with syphilis, there is a small chance that if they have what we call secondary syphilis, they have a rash on their skin, and those actually have the bacteria in there. So if you touched the rash, if it opened and it got onto mucous membranes, then presumably you'd have an exposure and possibly get infection that way. But I don't know of anyone actually getting infected that way. It's pretty much a sexually transmitted disease. For men, sometimes it's a little hard. With gonorrhea, they might have some discharge, but usually no pain, and that might be it. Sometimes they'll have what we call dysuria, which is pain or discomfort with urination, and that's because the urethra is a little inflamed from the infection. But they can have no pain at all, no symptoms. Women with gonorrhea, chlamydia can have a discharge, they can have pain, they can have fevers, and they can, have, as I mentioned, the pelvic inflammatory disease, which can progress significantly. With respect to the syphilis, usually you'll see a sore, and it's a painless ulcer, and it usually will last for several days, and then it'll go away. And you may not even think about it afterward. And if you don't seek medical attention and get it treated, then it can develop into secondary syphilis. So the sore will go away, but the infection hasn't gone away. It's just it's spreading throughout your body and can cause further problems in the future. Then you can ultimately, after several months or a year or two, develop a rash from it, or further sores, and then it can progress from there. Well, it depends on the infection, but usually what we do, if we treat one STD, we treat them all, because often they kind of travel in packs. So we use something called ceftriaxone a lot for gonorrhea. The problem is that there's now some drug-resistant gonorrhea, so you can't always use that in certain areas of the country and certain areas of the world. We also we use something like Zithromax for the chlamydia, and with syphilis, it depends on the degree of infection, the stage. There are 3 stages. So if it's just the primary stage where they come in with the ulcer, then you can give them a shot of penicillin. However, if it's secondary syphilis where they have the rash, then you have to give them 3 doses of penicillin once a week. You give them a shot, so it's over a period of 3 weeks. If it's longer than that, or sometimes that's not effective, and they start having symptoms again, and you try to do that again. But if they have it and doing that doesn't work, or they have tertiary syphilis, then they have to get penicillin every 4 hours, I believe, for 2 weeks. So they have to be in the hospital getting penicillin. So it can be serious. People can develop neurosyphilis. I think with anyone, always be aware of your body and always be aware of who you're having relations with. If you are going to have any kind of sexual relations with someone who's not your spouse, who's not your monogamous partner, then it's always important to use a condom. Whether one of the things that you hear about, it's kind of not a secret, but one of those ugly little things that happens is people coming from America or from other countries going to poorer countries and basically taking advantage of the population there, especially young people, and paying for sexual favors. And whether it's that person or it's the person in that other country, someone can have HIV. This is a big problem with Thailand, that they can have HIV and other sexually transmitted diseases, and no one thinks about using a condom, which I think should always be at the forefront of someone's mind anytime they're going to go somewhere and have any kind of sexual relations. Even here, living here and doing that, I think it's very important. And I think that, again, it just shows that being an immigrant or not being an immigrant, that part doesn't matter. You should always be careful.